Why can't I straighten my knee after an injury? I'm Dr. David Geier, orthopedic surgeon and sports medicine specialist, and I provide education and commentary on all sorts of sports and exercise, injuries and injury treatments, and injury prevention for athletes and active people so that you can stay healthy and perform your best. One of the most common questions I get both in my practice when people see me in clinic and I get it on my website and everywhere in social media is my injury serious? And doing sports medicine, one of the most common body parts is the knee. So it makes sense that one of my most common blog posts on my website is 7 signs your knee injury is serious, because people suffer knee injuries and they wonder, is it a big deal or not? Is this something that I can put a bag of ice on it and rest for a day or two? Or are there signs that, hey, I may have done something serious? And so in today's Ask Dr. Geier video, I answer a question about a sign that potentially could be serious in a young cheerleader. Tracy asks, my daughter does cheer. She was tumbling yesterday, landed funny, and hurt her knee. She has pain on the side of her knee and the back of the knee. She can't straighten her leg. I'm just wondering what this might be. Should I call her doctor or just ice it and have her take Motrin? She's currently wearing a knee brace and limping. Well, Tracy's question is so good, and again, there are a number of signs that an injury can be serious. It really gets to more than I can talk about here, but she mentions one that I think is potentially a big deal. And that worrisome sign is you can't fully straighten your knee, especially in somebody young. And I'm not picking on people in their 50s and 60s because, that's just not what I'm talking about. But young athletes in the sports medicine world, we're thinking middle school, high school, maybe college age, even though physiologically you may be very young playing tennis in your 50s or 60s. So ignore that for a little bit, but let's take the case of maybe a 16-year-old. Well, let's just use Tracy's daughter here. I don't know how old she is, but I would assume she's fairly young, okay? So you have an injury where something clearly isn't right. It hurts, it's swollen, you have pain in a very specific location. All could be potentially bad, but also maybe just remnants of a mild knee injury that'll go away in a couple days. The concern, I think, with that and any young athlete that potentially has that is not being able to get the knee all the way straight. Sometimes that can just be a swollen knee that makes it difficult to get straight. But very often, and again, high school age, maybe college age, certainly younger kids, but you mostly see it in roughly high school age people, is that they can't get their knee straight because something is physically blocking the knee from getting all the way straight. And very often, that's a meniscus tear. That's the C-shaped structure that you have. You have one on each side of the knee, one on the inside, one on the outside of the knee, between the femur or the thigh bone and the shin bone. They're shock absorbers. And young athletes can tear those in such a way that the inner part of the meniscus flips into the center of the knee and then blocks motion so that you can't get the knee all the way straight. So it's got to be more than just maybe pain that's keeping you from getting it all the way straight, but if there's a mechanical block to motion and it just won't go, even when you press it and it just won't go, that's a sign that is potentially worth checking out. But even if it's not a mechanical block to motion, you can have difficulty getting it all the way straight after, say, an ACL tear, an anterior cruciate ligament of your knee, where your knee's really swollen and it just won't go straight. That's a serious injury too. So generally, I think if you can't get your knee all the way straight, maybe you've rested it a day or two, maybe you've tried ice and staying off of it for a day or two, and you still can't get it straight, it's probably worth getting it checked out. Okay, have you suffered a knee injury and struggled to get your knee all the way straight, or maybe bend your knee after the injury? What did you do about it? Did you go see a doctor? And what did the doctor tell you about it? I would love to hear your experience. So below this video, tell me what happened. Tell me about your injury. I would love to hear your experience, and I bet everybody watching from the United States and everywhere around the world would love to hear your experience, because I bet they're going through something very, very similar. Okay, if you know somebody dealing with a knee injury right now, please share this video with that person. I want to help people that are trying to decide, do I go see a doctor or do I just give it more time? So please share this video. If you like videos like this and you want more information on sports and exercise injuries and injury treatments and injury prevention, I record a couple of these videos every single week. So click the subscribe button in the upper right side of the page, subscribe to my YouTube channel, and you'll get videos on ways to stay healthy and perform your best delivered directly to you. Thank you so much for watching. I hope this video was helpful. If you're dealing with a knee injury, or maybe somebody in your family is dealing with a knee injury, I hope this was helpful to let you decide what you do as far as getting it checked out. I look forward to seeing you right here next time.